The healthcare system is built on the promise to heal, to understand, and to care, but for many women, that promise rings hollow. This is a silent struggle, the fight to be heard, to be believed, to receive accurate and timely diagnoses. All too often, women's health concerns are dismissed, their symptoms minimized, their pain attributed to emotional or psychological factors. This mini-documentary will explore the pervasive issue of gender bias in medical diagnoses and inequality that has deep historical roots and continues to affect women's health outcomes today.
21 years ago, I hurt my back, and my primary care doctor said, "Oh, do more ab exercises." Last year, 20 years after initially having a back issue, my primary care was so tired of hearing me complain about my back and having done all of the physical therapy with no relief. She sent me to a pain center who did an MRI, and it turns out that I have advanced degenerative disc disease. I have multiple nerves being pinched in my back. The pain center neurologist was stunned that I was functional.
So I was really itchy and I went to a doctor and they just told me that I needed to take like an allergy pill or put on cortisone or like a cream to help the itchiness. And in reality it was allergies, like pretty severe allergies. So yeah.
Historically, medical research and practice have centered on the male body. This lack of research focused on women has led to significant gaps in our understanding of how disease manifests and progresses in women.
That I say because I'm a woman, because I know many men that have had less painful back issues immediately MRI'd and received care when my doctors kept telling me it's nothing.
I'm not totally sure, but I believe that it was possible. Because whenever I went to another doctor who was female, she actually listened.
That's hard to say. No one has ever come forward to me saying that they felt like a gender bias has played a role in not receiving a proper diagnosis. But it is getting harder now, and I think more people will be impacted by that, especially, the under 18 community that's transgender, that, at least in Arizona, in some places can no longer receive their transgender care. So access to care and bias because of their gender is going to be going up.
A phenomenon often referred to as medical gaslighting can have devastating consequences for women's physical and mental health.
It definitely limited the activities that I was able to do from an exercise standpoint, which I think has resulted in additional weight gain. And just in general, having to limit activities, and if I do one activity a day, I can't do anything else, sometimes for the next couple of days because of the pain in my back.
I just think that doctors need to listen to women when talking about their bodies, and not blaming it on like hormonal stuff.
Especially some diagnoses, it can be a matter of life or death. If you miss something, if you don't do the right scan, if you don't have the right diagnosis.
I think that doctors should with the use of AI and technology, if they type in a diagnosis, there should be steps that they follow regardless of gender. So if a woman says she's experiencing anything, they follow the exact same steps that they would follow if a man was saying that a man was experiencing that. And really just, listening and caring.
I guess just talking to a female doctor, because she really, they really know what we're feeling. And if it's hormonal stuff or actual medical issues.
As the minority stress model suggests, the chronic experience of being dismissed and disbelieved by healthcare providers can lead to increased stress, anxiety, and depression, further exacerbating health issues.
Having clinics in Tucson alone close their women's services or limit care to women's services by not having enough providers, not having enough locations. Those are all access to care, or just the program cuts where people can't get their birth control, their prenatal care.
I've been able to find specialists that pay attention. I do read a lot of reviews to make sure that I'm getting to the right place.
It just made everything really hard since I'm in high school and I have a lot of like out of school commitments. I've had to miss a lot of activities.
This lack of research translates into lack of knowledge. Diagnostic criteria, treatments, guidelines, and even drug dosages may be less effective or even harmful for women because they were developed based on male physiology.
Versus communities or medical professionals that have helped you navigate these challenges?
I think the medical community in a whole is pretty good about networking and talking to each other, so that if we can't get, say, a patient into cardiology, I have a list of doctors that, you know, I have met and can call just for a curbside opinion, and 9 times out of 10 I can get them a patient in the same day just by doing that, just by seeking consultation and working together with that.
Ultimately, the path forward lies in recognizing and valuing women's health. It requires a commitment to listening, learning, and creating a healthcare system that serves everyone with fairness and respect. The silent struggle must end.